Dr Mayoni. I absolutely loved your panel talk today. You know, you're the Vice President of the British College of Functional Medicine. So tell us a little bit about your history, because you haven't always been in functional medicine, have you?
I am an allopathically trained doctor, so that means I went to medical school in the UK. I did a BSc in the middle of my medical school training and then left, became a surgeon. I did a PhD in the middle of my surgical training as well, and went on and completed that training with a view to be a colorectal and pelvic floor surgeon.
What does future-proofing of health mean to you personally and professionally?
Future-proofing, I think, really is about understanding your personal genetics and how they interact with your environment. And this is what we call epigenetics. The truth is we can actually make our genes really amplified by eating really well. So looking at basic lifestyle maneuvers, sleep, movement, reducing toxic substances, stress management.
And what do you want everybody to think about functional medicine?
I think there is a place for everything, and conventional medicine has evolved out of necessity to try and help manage a symptom, and that's fine. There's a place for everything, but the reality is the vast majority of people have got chronic conditions and they need help navigating their health. They need to understand how they can use their genetics, how they can use food, and all the things we talked about to optimize their health.
Okay, so we're talking about epigenetics, how you carried on that gene. What is it that you guys really do? How would people find out if they had a chronic disease without actually feeling like they've got one?
First of all, for me, it's taking a really good history. All of those things are really deep pieces of information that I can start to build a picture of your current health and your longer term health, because your health is not just what happened to you today.
Yeah. I briefly heard earlier that, you know, there's lots of people kind of underneath you within the functional medicine kind of world. How are you working with them, and what's the message that you want to kind of put out there?
The BCFM was set up to really help doctors practice functional medicine in the UK, and we are aligned with many other allied professionals in this world. We've got fantastic people in the ecological medicine space, people in BANT, which are British Association of Nutritional Therapists. We work with osteopaths and chiropractors and people, what has just always been described as the alternative health space, which is slightly, I find, offensive because it always sounds like it's a kind of backup option. Whereas for many patients, they are navigating the world of Google and this holistic space on their own with no support. And they go to their healthcare provider and they have no support because they're not well informed enough about the options. And a lot of healthcare providers do want to help, but they don't know where to go. And we want to be that resource. We are that space where they can learn and read about it.
Well, listen, it's fascinating. So thank you so much. Keep doing what you're doing.
Thanks, lovely. Thank you.